leaky bladders the same? Are there different reasons and different treatments? Hi, I'm your local OBGYN. I love women, and I am constantly facing women who are miserable with a myriad of urinary issues, okay? The most common things that I see are number one, stress urinary incontinence. It's that leaky bladder, leaky pipe thing when you cough, sneeze, laugh, carry heavy things, okay? This is an anatomical issue. Number two, overactive bladder. This is a situation where the muscles and nerves are overreacting and causing the bladder to squeeze and put pressure to make you feel like you have to urinate more frequently. There is something called overflow incontinence, and this is when that muscle and nerve ending doesn't work around the bladder, and therefore you fill up so much that at some point some just dribbles out because there's nowhere else for it to go, because the bladder is forgetting to squeeze. And then there is mixed incontinence, where it's some combination of these different things. This can all be tested with a urogynecologist. They are board certified in urology and gynecology, where they can really test what the pressures and systems and leakage issues are from your bladder to determine what is the optimal treatment for you. You have all the symptoms of a UTI, frequency, burning, pain, but maybe it's not a UTI. Are you missing the big picture? Hi, I am your local OBGYN. I love women, and let's talk about it. When you have frequency, burning, pain, it is very common to think, hey, I probably have a UTI, because that would make the most sense. Go to an urgent care, your primary, your GYN, get a urine analysis and a urine culture, but sometimes those things come back negative and you are still stuck with the symptoms. So what is next? Let's think about the anatomy. If we look at our lady parts, here's the vagina, there's the pee hole. And if you think about how close these things are in proximity, a vaginal infection can really irritate your pee hole, make it inflamed, swollen, and angry. The most common infection I see is a yeast infection, which can inflame the pee hole and make you have all those same symptoms. A culture or even a visual inspection is enough for some people. It can be any type of vaginitis, BV, STDs, things like that go from the vagina and just inflame that urethra. There can also be injury to that area caused by intimacy or something like that. Or I've even seen herpes lesions on your urethra, which are exquisitely painful, but people don't always realize that that's what's going on. The other thing, which is really common in my ladies in our 40s and 50s, is we just have really thin, delicate, irritable skin. Okay. And that being said, vaginal atrophy can give you a lot of those similar symptoms, as well as chronic bladder pain syndrome, previously known as interstitial cystitis, where everything just seems angry. So it's definitely worth getting checked out if you feel like you have all these UTIs, but you're not getting relief with over-the-counter treatments or the antibiotics you just keep getting real quick at your urgent care or sent to you over the phone. Urinary tract infections are not particularly interesting to most people, but they can be one of the number one reasons why people are admitted to the hospital. Hi, I'm your local OBGYN. I love women, and let's talk about it. So UTIs, so common. Most women have had one. Most of you can actually identify the symptoms of it and give us a call and let us know, do you really feel like you're having those symptoms? And the recommendation is to consider treatment over the phone. But why do we harp on you to go in and get urinary cultures? Here is why. Not everybody is great at this. So it's not unreasonable to go and get a culture done to make sure, hey, is that really what your symptoms are caused by? Number two, there could be some vaginal infection that gives very similar symptoms as well, or it could be some other bladder complaint. Then if we do find a urine infection, we want to make sure that we understand what the bacteria is, and do you have resistance to certain antibiotics? Because we don't want to keep giving you things that aren't effective, number one. And number two, we don't want to give you like 15 different antibiotics over time and then make your urine infection almost impossible to treat with oral medications, requiring you to go to get IV medications. So urosepsis, which is when the urine infection causes sepsis into your entire body, is one of the most common reasons that women are admitted to a hospital. So we do take it seriously. It doesn't seem like a particularly interesting medical complication, but it is super common. It is one of the big reasons for hospitalizations, confusion, and the need for intense medical treatment in our later years. It's game day weekend, and I bet a bunch of you who would tailgate might experience leaking while you're laughing, coughing, drinking, throwing a ball around. Hi, I'm your local OBGYN. I love women, and let's talk about this one. So, leaking constantly from your bladder can feel super annoying. People get really self conscious, like they smell, even though it's really not as bad as you think, and worry, what can you do? So, here are some options. Number one, the quick and fastest thing to do is go to your local grocery store. There is a tampon that is called Impressa. It is specially shaped to compress your urethra. You can use it during higher activity days, days where you don't have as easy access to bathrooms to keep yourself empty, and it is a great quick fix, not sponsored by them, but something to consider. Number two, you can do pelvic floor therapy. If you find a great pelvic floor therapist, they're amazing. They can show you muscle strengthening exercises that can make a big difference. Number three, vaginal estrogen can plump up that tissue and sort of close the pipe down a little bit so it is less leaky. So it might be worth considering. Number four, pessaries. If you don't know what they are, look it up. They are these silicone-shaped things that you can insert into the vagina. There are different shaped ones for different reasons, but there are ones that support the bladder and compress the urethra a little bit. And then there are specialists called urogynecologists who are trained in both urology and gynecology, who basically rebuild the anatomy the way that you came out of your mama. So it is something else to think about. Hope this helps.